Μου τηλεφώνησε ο γιατρός που είχε κάνει τη γαστροσκόπηση. Εγώ δεν είχα συνειδητοποιήσει τίποτα. Του λέω δείχνει κακοήθεια, μου λέει ναι, κάτι δείχνει. Ελάτε από εδώ γιατί πρέπει να δράσετε γρήγορα. Και μου είπε ότι έχω ένα αδενοκαρκίνωμα σε πολύ πρώιμο στάδιο και πρέπει να τρέξω να εγχειριστώ.
Gastrointestinal cancer is a cancer of the organs of the digestive system, including the esophagus, stomach, small intestine, large intestine, colon, and rectum.
The gastrointestinal system has a variety of organs, all of which can develop malignant tumors or cancers. The garden variety cancers that we all have heard of and are worried about, such as stomach cancer, colon cancer, they arise from the lining of the GI tract, from the inner shiny red layer similar to what you have in your mouth, called the mucosa or the epithelium, and those are epithelial cancers, also known as carcinomas.
Stomach has 4 layers. The first layer is mucosa, the second is submucosa, the third is the muscle layer, and the fourth layer is the serosa. A tumor originates from the mucosa layer or sometimes as cancer.
Tumors that develop from the muscle or blood vessel or nerve components are also called subepithelial because they are below the epithelium, the lining of these organs. They are rarer, and when they start as precancerous lesions that then progress to the cancerous lesions that are a particular rarer category of cancer called the sarcoma.
But sometimes tumors originate from the submucosal tissues or submucosal tumors. So lesions originate from the stomach are classified 2 types. First is cancer, the second is submucosal tumor.
The most common of these variety of tumors arises in the stomach and they are called GISTs, which stands for gastrointestinal stromal tumors.
Colorectal cancer is a malignant disease of the large intestine. It usually begins with a colon polyp and then develops from a polyp that's benign to a polyp that becomes malignant, and as the polyp grows in size, it becomes a true cancer that invades the wall of the colon and eventually spreads throughout the body. Actually, when we talk about colon and rectal cancer, they're really the same disease. Colon cancer occurs further up the intestinal tract, where rectal cancer is right down by the very exit of the large intestine, and that is rectal cancer.
Early stages are limited just to the superficial structure, to the inner part of the colonic wall, and in case of progress it grows through the muscle layer and then to the adjacent organs, and advanced stages then cause metastasis of the lymph nodes or even of other organs.
Οι παθήσεις του γαστρεντερικού συστήματος είναι πολύ σημαντικές και επειδή τα συμπτώματά τους είναι πάρα πολύ λίγα, θα πρέπει να προλαμβάνουμε τις πρώτες εκδηλώσεις.
Colorectal cancer is one of the most frequently diagnosed cancers. Adding stomach cancer and other cancers of the digestive system, the estimated number of new gastrointestinal cancer cases totals millions of cases worldwide.
It's quite evident that colon cancer occurs more in developed countries like Greece, United States, Australia, than in undeveloped countries like in the heart of Africa. And there is a correlation between income and colon cancer. As countries and people become more rich, they develop a different lifestyle, and we think that may promote colon cancer.
The incidence of colorectal cancer is increasing in worldwide, and the situation is the same in Japan. The reason might be the one is the dietary habit change, and also, now of course, the older age of the people is the second reason.
Is in particular high in highly developed countries because of genetic factors, or maybe also because of the nutrition of low fiber diet or fast food, because we see changes in Japan. Colon cancer was very uncommon 30-40 years ago, and due to change to more Western style of nutrition, it's now even more common than gastric cancer, which is quite high.
In the past, the gastric cancer is more found in the Japan, in the Eastern Asia, and so on. If Easterns move to the Westerns, the next generation will have a low incidence of the gastric cancer.
Approximately 60% of people newly diagnosed with colon cancer are age 65 and older. Age, diet, and previous stomach disease can all raise the risk of developing gastric cancer.
Χρόνια είχα πρόβλημα με το στομάχι μου. Πάρα πολλά χρόνια, από την εφηβεία μου. Και είχα τα πάντα. Είχα γαστρίτιδα, βολβίτιδα, διαφραγματοκύλη, γαστροοισοφαγική παλιδρόμηση. Είχε βρεθεί ελικοβακτηρίδιο, ο γιατρός μου είχε πει να πάρω φάρμακα. Το ελικοβακτηρίδιο μάλλον ενέχεται με ένα μεγάλο ποσοστό σε μια εξέλιξη για καρκίνο.
Cause of the gastric cancer till now is still unclear, but is associated with diet, environment, genesis, smoking or drinking, a very hot or serious food. We should avoid such stimulus foods and so on. Heredity is another important cause of the gastric cancer.
The main risk factors for developing colon cancer are poorly understood. We think that the only way we can tell who is at increased risk is the family history.
The genetic factors play a role in about 1/5 of the patient. That means you have an increased risk if first-degree relatives have colorectal cancer. For example, when one of your parents has cancer, then it increases the risk to 1.7-fold, and it's even higher, and there may be a genetic defect if there are even more relatives who have CRC, the colorectal cancer.
Εγώ είχα πάει να κάνω μία εξέταση προληπτική, μία κολονοσκόπηση, γιατί είχε νοσήσει ένας πρώτος μου ξάδελφος και είχαμε και μία γιαγιά. Η κοινή μας γιαγιά είχε πεθάνει από καρκίνο του παχαίου εντέρου και ο γιατρός του ξαδέλφου μου είπε ότι πρέπει όλοι να κάνουμε προληπτικά μία κολονοσκόπηση, τα εγγόνια.
We think that it takes 5 different genetic faults to develop a colon cancer. So it doesn't happen very often, but in the United States, 1 out of every 20 persons will get colon cancer.
In a smaller subsection, there is an association with a family history. Then there are the sporadic cancers where environmental factors are absolutely crucial, and those are obesity, relatively high-fat diet, diabetes, and other comorbidities.
The nutrition obviously plays a role. That means low fiber diet and too much meat is increasing the risk of developing colon cancer. But on the other hand, even vegetarians have a risk for colon cancer. So it's not a guarantee when you live very healthy with a lot of exercising and good nutrition, you still may develop a colorectal cancer.
Έκανα την κολονοσκόπηση και με πήρανε τηλέφωνο ότι είναι έτοιμη η απάντηση να πάω να την πάρω και είναι καθαρή.
But we also know that age is a factor for colon cancer. As patients or people grow older, past the age of 50, colon cancer markedly increases. There may be only 4% of people that will get colon cancer less than age 45. But as the population gets older and older, at the ages of 60 to 70, colon cancer reaches a peak.
So we know that there is an increased risk of developing colorectal cancer in patients with inflammatory bowel disease, either Crohn's disease or ulcerative colitis, which is extensive, and in patients who've had the disease for more than 10 years.
Signs of early gastric cancer include indigestion and stomach discomfort or pain. Signs of colon cancer include blood in the stool or a change in bowel habits.
For the early gastric cancer, there is no obvious symptoms, but if the lesion advanced, the patient may have the abdominal pain, vomiting, nausea. I think this is the later stage of the cancer.
Τα συμπτώματα που είχα μέχρι τότε ήταν αυτά που είχα πάντα ως άνθρωπος που υποφέρει από το στομάχι του. Και ούτε δικαιολογούσε το στάδιο του καρκίνου στο οποίο ήμουνα να έχω περισσότερα. Από ό,τι λένε, όταν φτάσεις να έχεις συμπτώματα από τον καρκίνο του στομάχου, είναι ήδη αργά.
It's important that patients are aware of the symptoms of colorectal cancer, which include rectal bleeding, which is persistent. It includes change in bowel habit, particularly towards looser stools, not constipation, though constipation can be a risk as well. If the patient becomes anemic or becomes tired, has a mass which they can feel in the tummy.
The major symptom of colon cancer is bleeding, because when polyps grow, they become very friable. They tend to lose blood, and as the bleeding occurs, if it occurs far up in the colon, the patient doesn't see it because it mixes with the stool and it looks like normal stool. If it's down lower toward the rectum and they bleed, it comes out as red blood. So patients have to be attuned to the fact that they must look for blood in the stool, because that's one of the early symptoms of colon cancer.
So if you have unexpected blood in your stool, or crampy pain, or changes of your stool habits, so especially a change of diarrhea, a soft stool, and obstruction, signs of obstruction, then it is a more likelihood of cancer, and this is then a stage that usually we have to expect a more advanced stage.
During the gastroscopic examination, we always check the HP. If the HP test is positive, the bacteria should be treated with some antibiotics.
Blood tests and endoscopic techniques which examine the stomach and esophagus are mainly used to detect and diagnose gastric cancer. After colon or rectum cancer has been diagnosed, tests are done to find out if cancer cells have spread within the colon or to other parts of the body.
As for the diagnosis of the gastric cancer, we can find more and more early gastric cancer by the gastroscope. So the gastroscope or gastroscope screening examination is very, very important.
Μου είπε να βγάλω αξονικές τομογραφίες άνω κάτω κοιλίας και πνευμόνων, ώστε μόλις περάσει το τριήμερο να πάω να βρω γιατρούς, γιατί πρέπει να εγχειριστώ γρήγορα, πράγμα και το οποίο έκανα.
Colonoscopy, that means endoscopy of the bowel, is the method of choice because we can visualize the whole colon and the rectum. And this is also important for screening. It's the most effective method for screening because we are able to identify polyps, which are precursors of the cancer.
When we think about population screening, because we're talking about much bigger numbers, we need to use simpler tests, and the most commonly used one now is the fecal occult blood test or the fecal immunochemical test. These are simple tests where we look for blood or evidence of blood in the poo.
You can test the stool for DNA, you can test the stool for blood, but if you find a positive test, the patient needs a colonoscopy.
They are not as sensitive or specific as endoscopy, but they are very safe because they just involve testing some stool. But obviously if a test is positive, then the patient would then require a colonoscopy, which is a more invasive test, and there is a very small risk associated with that, mainly from polypectomy and removing polyps, which need to be removed.
The other tests for colon cancer, such as the virtual colonoscopy or the CT scan, is worthwhile, and it's almost as good as colonoscopy for making the diagnosis of colon cancer, but it's not so good for making the diagnosis of polyps.
It is very important to do the screening test such as FOBT, fecal occult blood test, or the screening colonoscopy in order to detect early colorectal cancer in a very early stage and to treat them endoscopically.
Rectal cancer is a particularly dangerous cancer to have, but the cancer that requires a colostomy can always be found by performing a digital rectal examination by the referring physician or by the primary physician. So it's very important to have doctors perform a digital rectal examination, and that can discover these low-lying cancers that require a colostomy for cure.
Πρέπει να εκπαιδεύσουμε τους παθολόγους και τους γενικούς γιατρούς, οι οποίοι είναι οι πρώτοι οι οποίοι έρχονται σε επαφή με τον ασθενή, να του ορίσουν ποια είναι η προληπτική εξέταση που πρέπει να κάνει ή πότε θα πρέπει να τον απευθύνουν στον ειδικό.
Like in any other malignancy, it is only after the stage of the cancer has been established that one can start planning the treatment. If the cancer has spread to lymph nodes or other places in the body, more radical treatment options might be sought for.
Colon cancer has markedly decreased in incidence, and we think that the marked decrease in incidence is due to colonoscopy, taking out colon polyps, finding them, removing them before they become cancerous. So it's a very important procedure, is looking for the early polyps, removing them before they get to be colon cancer.
We can choose the appropriate treatment choice for colorectal cancer without biopsies. So the endoscopy using magnification is almost the optical biopsy technique at this moment.
Even though sarcomas are rarer than carcinomas, they are as lethal as carcinomas. And that's why it's recommended that these GIST tumors are removed when they are as small as 2 centimeters, so that you don't allow them to gain more mutations and transform into a full-blown malignancy, a sarcoma.
The resection of the tumor should be conducted if the diagnosis has been made. For early gastric cancer, we cannot resect the such lesion on the endoscopy. So this is a minimally invasive surgery for such patient. The patient could drink cold water the next day or go home 2 or 3 days after the endoscopic resection.
Only in selected cases endoscopic resection is appropriate, because in most of the cases the cancer is already infiltrating deeper layers of the wall of the colon, and therefore we don't know if there are not tumor cells in the surrounding tissue, in particular in the lymph nodes, and therefore the vast majority of patients have to undergo surgery for resection of the part of the colon with the cancer and the associated lymph nodes.
If the cancer invasive, the deep layer accesses to the submucous layer, a surgical operation is always recommended. There are some adjunctive treatment for the gastric cancer, such as chemotherapy and radiotherapy and so on.
Καλή ήταν η έκβαση του χειρουργείου, αφαιρέθηκε ένα πάρα πολύ μεγάλο αυτό, 9 δέκατα του στομάχου αφαιρέθηκαν. Είχα όμως μετά προβλήματα. Αδυνάτησα ακαριέα πάρα πολύ, έχασα κιλά γρήγορα.
There are these offshoots of poem that allow again peroral through the mouth endoscopic surgical removal of these tumors, again with no surgical scars and the associated problems with wound infections, pain, later return to work, longer stays in the hospital, etc.
So if we find the early cancer, we can resect it on the endoscopy, and the stomach could be resolved. The quality of the life could be improved.
The prognosis very much depends on the stage. So that means in the early stage, if it's just limited to the wall, the curative rate is about 80 to 90%, but in case of metastasis, it goes down to 30 to 40%.
You can lower your risk of developing cancer by managing the risk factors that you can control, like diet and physical activity.
Since the cause or etiology of this cancer is still unknown, so the prevention sometimes, from my point of view, is very, very difficult.
High vegetable diet, decreased red meat, increased exercise, less obesity are all factors that have to do with the development of cancer in the body, not necessarily colon cancer. But we think that the important single factor in development of colon cancer has to be genetic.
Therefore, it's strongly recommended that everybody over 50 should undergo a screening procedure.
So therefore, the mass screening program is the key to prevent colorectal cancer deaths.
Όταν βρούμε ένα πολύποδα καλοήθη ο οποίος δεν έχει συμπτώματα στο παχύ έντερο, το αφαιρούμε και άρα εξαφανίζουμε την πιθανότητα αυτός ο πολύποδας μέσα στα επόμενα 5-10 χρόνια να γίνει μια κακοήθεια. Γι' αυτό το λόγο ο τακτικός έλεγχος του παχαίου εντέρου θα τείνει κάποια στιγμή να εξαλείψει τον καρκίνο του παχαίου εντέρου.
Έχει αλλάξει η ζωή μου λοιπόν προς το χειρότερο. Αλλά γενικά νομίζω ότι είναι καλύτερα από πριν από την άποψη του ηθικού μου μέσα. Δηλαδή ότι έχω μάθει να εκτιμάω τα απλά πράγματα τα απλά πράγματα αυτά της ζωής.